This lecture is on problems that can occur in your digestive system. So we're going to start with the gallbladder. You remember the gallbladder? It stores and concentrates bile. It is located between the lobes of your liver. Now, the gallbladder stores and concentrates bile, but if the bile becomes too concentrated, then crystals can form, and these are what are commonly called gallstones. And this condition then is called, and we have a huge word here, are we ready now? Polycystitis, meaning stone, iasis. Polylithiasis is the technical term for having gallstones. Now, I should say that this is not automatically harmful, just so you know. But if large gallstones jam up, that is to say, block the cystic or the bile ducts, this now has a new name. This is polycystitis. Now you've got a problem. So this can be very painful. The gallbladder, because it cannot get rid of its contents, then becomes swollen and inflamed. So that's just gallstones in general. Now, if the bile ducts become blocked for other reasons, then bile stops being excreted. And bilirubin levels in the blood then increase. And this leads to the condition that we call jaundice. And its symptoms then are yellowish skin and eyes. So what you are seeing in this second case then is basically that bile is no longer, or rather that bilirubin is no longer being taken out of the blood. Remember, bilirubin is a waste product that the liver usually takes out, puts into bile, and it gets excreted that way. In the absence of that process, then you wind up with bilirubin remaining in your circulating blood and slowly building up, and then you wind up getting sort of yellowish skin and eyes as a result, and this is the condition known as jaundice. So the liver itself can also have problems, and among them are the various diseases known as hepatitis. Again, hep means liver, itis means inflammation. So we have, to begin with, hepatitis A. And this is sometimes referred to as infectious hepatitis. And you get this then from ingestion, from eating, basically. So ingestion then of food, water, milk, or shellfish with fecal contaminants. Then we have hepatitis B. So this now is from blood products, sometimes called serum hepatitis. So both of these are viral diseases, and these diseases attack the liver. So you can wind up getting hepatitis A through various different food products or drinking that might have fecal contaminants. Hepatitis B is a blood-borne pathogen. It has similarities to AIDS in the ways that it is transmitted. And so here you've got these viruses now that will attack the liver. They may attack other organs. And these are very dangerous. And they also create an elevated risk for liver cancer. And both hepatitis A and B can be treated and can be prevented by vaccines. And there's hepatitis C. So then there's hepatitis C. This is more newly discovered. This is also very dangerous. This is also a blood-borne variety of hepatitis. So you can get it through cuts, through dirty needles. One way that it was originally transmitted a great deal, the way that we kind of wound up discovering it, was because tattoo parlors were using dirty needles, and a lot of people with tattoos wound up getting hepatitis C. So as I said, this is transmitted through blood-to-blood contact. This is now treatable, though we still don't have a vaccination for it. Okay, so that then is hepatitis. A different liver condition is called cirrhosis. And this is sometimes thought of as a hardening of the liver. And what happens here is that you see the destruction of hepatocytes, that is to say liver cells. I'll even write that in. Liver cells, remember hep has to do with liver, cytes are cells. So destruction of hepatocytes then by, and there's a lot of things that can do it, drugs, alcohol, viruses, and also blockage of hepatic ducts. So the problem here is now that you have some liver cells that are not alive, which means then that for the blood to get cleaned, all of the little veins that were going through that dead, hard tissue now wind up going around that dead, hard tissue, and the liver becomes less organized. It's really the best way that I can describe it. It becomes less organized due to scar tissue. You actually wind up with scarring in the liver. For instance, in people who are long-term alcoholics, they've destroyed so much of their liver that, as I said, parts of it are hard, they are scarred, and as a result, blood winds up being diverted around those areas, and this can create a lot of problems for the liver. So that then is cirrhosis of the liver. Another GI tract problem in a different part of the GI tract is esophageal reflux. So this is basically backflow from the stomach into the esophagus. It is commonly known as heartburn. It has nothing to do with the heart other than the fact that the area where that backflow occurs and the pain occurs is kind of sort of near your heart. So esophageal reflux, remember the gastroesophageal sphincter is not much of a sphincter. It does not really prevent this backflow. It is not like, say, the pyloric sphincter that really regulates the flow of the fluid, the chyme, from the stomach into the small intestine. It actually regulates it in ways that only allows a small trickle of chyme into the small intestine, so it's very well regulated. On the other hand, the gastroesophageal sphincter is nowhere near as powerful and capable, and we wind up getting backflow sometimes. And when you get backflow of stomach acid onto the unprotected esophagus, you wind up feeling pain, and that is what's known as heartburn. Another problem that you can get is called gastroenteritis. And this then is what is sometimes referred to as a clean sweep. Of the absorptive areas. So basically, if there's anything that is in the absorptive areas of your GI tract, you get rid of it. So there's basically two directions that food can take when your GI tract is getting rid of it. So vomiting, then. Empties the stomach, the duodenum, and part of the jejunum. And then peristaltic contractions empty the distal jejunum and ileum. So basically you get vomiting and diarrhea, and that gets rid of everything that is in your system. So, just so you know, where you see enteritis, that then refers to conditions affecting the small intestine. So you kind of look at the word. Gastro has to do with the stomach. Entero has to do with the small intestine. Itis tells you it's an inflammation. Tells you the system is unhappy. All right, so that then is gastroenteritis. Basically, that is your GI tract getting rid of things that are bothering it. Then we have cholera. So cholera then affects the colon. So this is a disease of the large intestine. And in this case, it's a bacterial disease. And the bacteria release toxins. That stimulate massive fluid secretion. And so fluid loss, essentially diarrhea. Fluid loss can be so severe that people can die of dehydration in hours. This is a serious, serious condition, and unfortunately, it is very communicable. So you can have cholera outbreaks, you can have cholera epidemics, and one of the tragedies of some bacterial diseases is that it's not enough to kill the bacteria. The bacteria may be what are making you sick to begin with, but then the real damage is done by the fact that the bacteria release toxins. And this means that if you have somebody who is kind of far gone with some of these bacterial diseases like anthrax, like cholera, even if you manage to get in with antibiotics and wipe out all the bacteria, you may wind up still having that person die because their bodies are so full of these toxins, poison, basically. So, as I said, you can have some tragic results even if you wind up getting the antibiotics. Basically, you need to treat with antibiotics early if you have cholera. And cholera is one of those diseases that, again, is spread through contamination of groundwater by fecal material, which means that very often you will see it where there has been a natural disaster. If you have an earthquake or a hurricane or something like that, and people are gathered together into evacuee camps where sanitary conditions may not be as good as they should be, then you can wind up with a cholera outbreak then taking place. Basically, a few people have cholera, or maybe there is cholera in the groundwater in general, and people wind up getting it. This happens often. So when there is a natural disaster, there's something of a race to basically get people into sanitary conditions before the cholera outbreak happens, because a cholera outbreak pretty much will happen if people are in unsanitary conditions, crowded together for long enough. Then another issue with the large intestine which is less dire, is diverticulitis. And this then is where pockets form in the wall of the colon. Remember, the colon has very thin walls. So this is the kind of thing that, let's say, we have part of the descending colon here, and you wind up with the sigmoid colon, like so. At places like this, where there's a certain amount of stress on the system, you can wind up with just little pouches forming, like that. So there, that then is a diverticulum. And these are subject to infection and inflammation. So, and by the way, in the wall of the colon, I will say that this is usually found in the sigmoid colon, as I drew it for you here. And this can lead to pain and bleeding. I mean, it's very stretched out there. This can be bad. And then in severe cases, then bacteria, remember you have plenty of bacteria in your colon, so the bacteria then may enter the peritoneal cavity. What I'm saying here basically is that there may be a small rupture in this overstressed bit of the colon wall there, and you may wind up then with some of the bacteria escaping into the peritoneal cavity. This, of course, is bad. I've said this before. You do not want to have bacteria in your abdominal cavity. Your abdominal cavity is actually sterile, and it wants to stay that way. So when you wind up having a perforation anywhere in your GI tract, that is automatically a problem, whether it's an ulcer in your duodenum or whether it is a diverticulum in your sigmoid colon. Either way, if you wind up having the contents of your GI tract getting into your abdominal cavity, even in very small amounts, this is a very, very serious condition. And that is it for this lecture. Thanks very much.